Have you ever come across somebody that comes running to you, crying uncontrollably, screaming out loud, or laughing hysterically? What would you do? And how would you react? Or have you ever pondered, or have you ever experienced that happening to yourself? Now, those are common basic emotions, that you may feel. And what you see on screen are basically the 6 emotions that we have ever experienced in our life. The first top row, the emoticons basically signifies one being happy, worried, and angry. While the bottom row signifies feeling of sadness, shocked or surprised, and indifferent. Most importantly, have you ever felt feeling, nothing? And you telling your friend that, hey, I don't feel anything today. Well, that is basically also a feeling or an emotion. Statistics have generally indicated these are the 4 main mental disorders that one experiences nationwide and globally. The 4 common mental disorders that have disrupted the world basically are anxiety disorder, schizophrenia, bipolar disorder, and also depression. And generally, what we are concerned about, because studies have actually indicated that our young people have been affected, and these numbers have increased by 2-fold. A brief report by the World Health Organization in 2022 have indicated at the onset of pandemic COVID-19 that the prevalence of anxiety and depression has surged up to 25%. And this is very worrying. And we could see the impact up till today. The young people, like I mentioned earlier, have been affected. For example, during COVID-19, the cancellation of face-to-face classes, socialization among friends. We being the social animals, social being who likes to socialize, being isolated, this has definitely impacted our young people. And mostly, all of us, we are also not exempted. And what is worrying, the Institute of Public Health has informed that the third person in Malaysia is actually affected by mental health. So let's try to understand what mental health is all about. The first question that we need to ask ourselves and understand is our self-concept. And the question that we need to ask is, who am I? So when we're talking about who am I, it is how one sees yourself, or one sees their own self, So basically, if you look at yourself from the positive outlook, so then you see this world as a better place. But if you see your love from a negative worldview, then you feel that the world is crumbling down at your feet. The self can then be categorized into 2 different areas that is known as ideal self and also the real self. So what is ideal self? Ideal self generally is who you want to be, but your real self is who you really are. And this congruence can only be achieved if the ideal and the real self is overlapping. Okay? But when I say overlapping, I'm not saying that it's overlapping as one, because that is impossible. That is only resulting in one being perfect. And there is no perfectionist or perfection in this world. Now, to understand this better, how do parents help our young people? By providing unconditional love, by providing unconditional positive regard. This helps our young ones to develop further and achieve their self-actualizing tendencies. The opposite, if the students, or rather the young people, do not achieve conditional, or they achieve conditional positive regard, or their worth and love is given and they have to earn it, the ideal self will result in them becoming people pleaser. Let's try to understand what mental health is now all about. As you know, mental health literacy is about understanding the components of mental health. So what is mental health? If I were to ask the gentleman over here, do you put or do you apply makeup today? Some of you, or generally most of the men will say no. But what if I were to ask you, what is your psychological makeup? What is your understanding of psychological makeup? Yeah? The psychological makeup is made up of 3 components. That is your thought processes, that's your cognitive. That will affect how you feel, and that will be translated into your behavior. So basically, the psychological makeup is your psychological well-being. And that means that what you think will generally translate into how you feel. Coming back to the self-concept. Now, when we also talk about understanding the psychological makeup, it's about how you view the world. It's about how one can take life and function daily when doing their life tasks. Yeah? What I wanted to basically propose today is the innovation of our young ones to become the advocates of mental health. So why is it important for all of us to understand mental health literacy? It is important because one needs to understand how a healthy body and mind functions, and what are the common mental health illnesses that exist in the world. And how and where can we actually seek help? And most importantly, is to understand that stigma exists, but how do we cope with that? Now, early detection is important as precautionary measures, but how are we going to be aware of what are the symptoms? The symptoms of having mental health issues, the first one is when you realize that your thoughts, when you can't sleep well, your sleeping hygiene changes, your behavior from you liking to socialize with people, but you tend to isolate yourselves. Your sleeping patterns, your eating habits, these are all part of how you could actually monitor the symptoms of whether you are functioning in your daily activities. Now, when I talk about awareness, why is awareness important? Let me ask you a question. Did you all have breakfast this morning?
Yes.
Yes. And what do you have for breakfast? Quaker oats. Some of you may see that you have sandwiches, peanut butter and jelly, tuna sandwich. Some of you may just say, I have coffee. The next question is, how was it? How was it?
Terrible.
Terrible. Some of you may say, good, excellent. But are you really aware what you ate? I had salad this morning. Okay? I was aware that the dressing of the salad was too salty. But were you aware that the coffee, the aroma of the coffee, were you aware that the meat that you had this morning, how was it? Was it tender? Was it tough? So when we're talking about awareness, a study has been conducted and has indicated that 10,000 of people, out of that 10,000, only 10% were really aware. Our awareness is important because that is the ability to seek help to minimize the mental health stigmatization. So when I talk about stigma, what is stigma? It is basically the negative connotation or the social disapproval that the society is putting on us. did you know, interestingly, that stigma is basically created by our own family beliefs, our personal beliefs. It is us, ourselves, that is creating that self-defeating behavior, self-deprecating behavior. So we are doing the self-sabotaging, and we're good at that. So let's try to be aware and understand that challenges in life will result in stresses, anxiety, and depression. So when I use the word depression, I'm a little bit confused here. Is depression a mental disorder or part of you? It can be part of you. So just imagine if last week all the students here are preparing for TEDx, and they also have exams at the same time, just assuming. So if you were to test them on, psychological tests, they will result in having extreme depression. So are you saying that these students are having mental disorder? No. It is just part of us and how one cope with the depressing situations. Yeah? So we need to understand the difference between mental health as a whole and what mental illnesses are. Now, once you pop the stigma, because we do understand now what our belief system or self-worth, so this is when our young people will be the best agent because they have the multiplier effect. Why do I say that? They talk about social media and they talk to their friends. They are the best influencer to be the agent of change. They are the ones will start young, and these people are the ones that can actually help in terms of advocating what mental health literacy is all about. And the reason why I share this is because mental health is the second largest health issues that is now rising in Malaysia after our heart related issues. So it is something that we need to consider. And being an advocate of mental health, these young people can go far in terms of nation building and be active in terms of innovations. So how do they innovate? In coming out with socialization activities, recreational activities to help promote mental health. Just remember, there is no health without mental health. Thank you.